I'm Jennifer Lotito, President and COO at RED. We're 40 years into the AIDS fight, and remarkable progress has been made. The big reason for that is the contribution of companies around the world, but especially the contribution of life science companies. Companies like Merck, ViiV Healthcare, IQVIA, and Roche, the sponsor of today's RED Talk. While it may not be in the headlines, HIV is still a crisis, and AIDS is still a crisis. And what we need to end that crisis is more partnership. So here to discuss that is Bernard Colombo, president of Roche Diagnostics for the Europe, Middle East, Africa, and Latin America region. Bernard, you've spent nearly 35 years working in the diagnostic space, hard to believe. But before we talk about that, can you talk about, if you recall, the first time you heard about AIDS, and really what made you get into the medicine and life sciences industry in the first place?
Very early, I had no idea what diagnostic was, and I intended to be a cook, but my parents did everything to try to discourage me with one argument: you're gonna have to work every weekend, okay? And that's how, the second option for me was really, I was interested by medicine and the science, but not science for science, really medicine on patients. This is, don't ask me why, this is what it was. I decided to study biomedical engineering, and I did my internship into a diagnostic company. And from that day, I never left the diagnostic industry. And I'm glad that I did so, because so many things change over the years.
Well, thank you, Bernard. Well, I hope that you are still pursuing cooking, maybe not as your career, but maybe on the side. Do you recall the first time that you heard about AIDS?
I look back at certain events and the cadence by which the awareness around AIDS grew up internationally. In 1984 is the year where, for the first time, a paper was published in the US about the possibility that AIDS be transmitted via saliva. When you think about that, so it means at my level when I started, AIDS was already existing. Some research were happening, but nothing was really well aware, by society at large. And if you think about, 10 years later, in 94, this is where AIDS was announced as the first cause of death in the US for population between 25 and 44. Okay, 10 years after that. Of course, I heard between 84 and 94, but I heard more about it, not by the number of deaths, but by the fact that we didn't know how to treat. We didn't know exactly how to test. The same year, 94, is the one where officially in the US, it was announced a research program for AIDS detection in blood. And it's only 10 years after, in 2004, that the first non-blood test for HIV was approved by FDA. So it means, think about the time, 20 years, during which science progressed, option of testing and option of treatment were identified. Okay, so it means, and still many things needs to happen, and the topic of awareness is not over. And that's exactly why you are doing what you do at RED.
Exactly. And it's amazing when you put it into context in thinking about COVID, right? So COVID happened, a test was developed, and here we are 3 years later. AIDS, as you said, it was 2 decades before you had a viable test. It's amazing. And I mean, it's crazy where we were, but the progress, when you think about the fight against HIV in comparison to the fight against COVID, it is a really interesting case study of the importance of testing, but how the testing world has changed. So we're going to get into that in a minute. But before we get into that, I want to talk a little bit about you and your career trajectory. You've obviously worked at a number of different life science companies, but can you talk about that career trajectory? So you didn't do what you wanted to do, thanks to your parents. You did not become a cook. But can you talk about that career and how you ended up at Roche?
I started really on the technical side of diagnostic, with equipment. I am almost 40 years now in this diagnostic field. Some people would say, how can you spend an entire life doing the same thing? I never got the impression that I ever did the same thing year after year, because the technology and the science evolved. And you just mentioned that, to a point where now we can react to a pandemic like COVID in record time. But also it means the market evolved. The awareness of the population evolved massively. So it means I really have the chance that at the end, I did my entire career in the diagnostic sector, but I had multiple lives during these almost 4 decades. How I reached Roche after different steps in different sector of diagnostic, it means Roche is a company that historically was highly focused on oncology. And on that part, I was in a small American company that has been acquired by Roche in the field of oncology. And I was in the package. That's what I keep saying to many people asking the question. Roche celebrated last year the 125 years anniversary. So it means it's super important. What is unique is we are a combination of a pharma division and the diagnostic division. There is no treatment option unless a patient is being diagnosed, and you need the diagnostic blood testing or a physiological testing. Equally, there is no point to do diagnostic if you don't have treatment option. And it's so relevant for me when we talk about HIV. Does it mean that we need to have always within Roche the diagnostic and the treatment? No. Diagnostic is, like it is for HIV, an option we want to give to patients. Okay, no matter where they are. And the treatment options can vary. And it may come from partnering with other companies. And when you think about the difference between thinking about our own success as a company or the success of what we do at patient level, this is what matters. And it is extremely important that we join forces if we want one day to be able to say that we can eradicate HIV, hopefully, okay, like we have been able to eradicate other diseases. So it means very grateful that I'm in a company who is open to partnership in this way, so we have an end-to-end solution for patients.
That's incredible. And it's such a fascinating story that I don't think people really think about on a day-to-day basis. And one of the things that I've always found really interesting about Roche, and I'd never thought of before until we started working together, is that the end of every pandemic begins with a test. So it makes total sense, but I would have never thought about it that way. And especially what you were just talking about with the treatment, you have to have a test in order to know what you need to be treated for. So it is that full circle that you talked about. And I don't know that people think about that every day. Certainly a pandemic like COVID made us think about testing much more. But can you talk a little bit about how testing and diagnostics have changed over the years? You've obviously been doing this, as you mentioned, for nearly 4 decades. But can you talk about those changes that you've seen, and where are there gaps still at this point today?
Yeah, and as I said, it means it changed, incredibly fast, and it changed. The good thing is science and industry offers work together in order to be able to give better tests, faster results for patients. We make the test possible where the patient is and as fast as required by the disease we are talking about. Not every disease has the same need of speed. And this is what we are doing in our company at Roche, and other diagnostic company are doing that. This industry has been helping to improve quality of the test, availability of the test, and speed of result to the patient. And we can achieve that by automation, and we achieve that by progress of science. I talked briefly about, when I started to work. I remember that in 84, the same way that I never heard about HIV, I never heard about sequencing. It was not a topic. Today, who would imagine treatment option for example, oncology or viruses? It requires sequencing if you want to understand the mechanic of the disease, the mechanic of the progression of the virus. You mentioned COVID. How many people before COVID time heard about the word PCR test? Now it means everybody is saying, oh, no, I got an antigen test or I got a PCR test, okay? Of course, they won't be able to explain what PCR is, but the awareness that a certain type of test is existing is there. And this is what has been remarkable, is the speed by which the science evolved and the understanding of the disease mechanism progressed over the years.
Yeah, that's really important. And when I think about it, the role of testing in the battle against HIV and AIDS, and I've seen this firsthand on the ground, on the African continent, which is how important understanding your status is, and knowing, the testing is the way in. And so, can you just talk a little bit? You talked. I thought it was really fascinating when you talked about the 2 decades it took in order to create that testing for the HIV virus. I'm just curious in terms of where we are now. Why is testing so important in the battle against HIV and AIDS?
The battle is important because, number one, it means if AIDS is being well understood by people, by themselves, about mechanic of transmission, options of treatment, it's not the case everywhere on the planet. The information is not spread the same way, and access to the test is not done the same way. But very important is, to your question about the relevance, why is it still relevant? Number one, we have options to prevent the progression of the disease. We have options to detect early, for example, pregnant women, okay? And we have option of treatment. And all that is, for me, all the condition of the hope we have continuing to fight against HIV. It's not tolerable that we have so many people who are still dying from this disease, where the topic of combined awareness, testing, and treatment can eradicate this disease. But we are miles away of this eradication.
It's obvious that testing is so important in the battle against HIV, but I want to go on a little personal level now, because testing, you are not only speaking it, but you are actually a living testament to the importance of testing, because you had a near-death experience, and testing was the thing that saved your life. So can you talk to us a little bit about how that access to testing impacted your life, and how has it shaped your outlook going forward?
Thanks for the question, Jennifer. Yeah, back in 2019, I experienced a heart failure. I was next to a community hospital, and thanks to one single test named troponin that indicates the stress of your heart muscle, it means the medical staff from this hospital could diagnose exactly what was happening and could direct me immediately to the right place by ambulance in order to get the necessary medical care that ultimately saved my life by almost something like 5 minutes more, and I would not have been with you today. So it means that's the value of a one single test done in record time and what it can do to a person. What it changed, I have been talking for decades about the value of diagnostic, I never thought that I was doing that, speaking theoretically about it. But after my personal experience, it gave me a different taste of what value of diagnostic is. And if many people think that what saves your life is the treatment, whatever option it is. Okay, in my case, it was a light surgery. And in fact, no. What saved my life is the fact that I was in a place where they could do this very specific test in record time. And I spoke about how diagnostic evolve. And I put an element that I never did before. I was talking about the science and where the test is being done. But there is one element that now I had, which is time to result. Okay, because it means if, like it was in the whole time, it would have taken 2 or 3 hours to get a result versus 20 minutes, which is what was needed. It means the difference between those two techniques that could be seen as diagnostic tests the same way, the difference for me is I am alive today. And this is for me the value of diagnostic.
I mean, it's an unbelievable story. And, you know, on every level, but especially that point you're making about the time, you know, this was a matter of minutes that you were looking at, and a difference between life and death. And that is just absolutely incredible. And I'm obviously very happy that you're healthy and here with us today.
Thank you.
But what a story, and especially for somebody who has spent decades in the diagnostics field. So really, really powerful. And thank you so much for sharing it. But now I want to switch back to partnerships, because we were touching upon that before your story. You know, when we think about the battle against HIV/AIDS, it's obviously been going on for decades. We can all admit that it's too big for any one company to solve, even any one country to solve. And we really need life-saving partnerships if we're going to do this, as you talked about, driving testing, treatment, care, all of it. When you think about partnership, what does it mean to you, and how is Roche advancing that value?
Yeah, partnership, you know, many people think partnership is an overused word, but as you exactly pointed in your question, nobody can fix such massive societal problem like the one of AIDS, you know, by itself. We need, like you do, it means, and I'm so glad that we have now this multi-year partnership. Okay, we started to see how can we join forces. Partnership is nothing else than joining forces around a common goal. And this is why I am not animated by a test. It's boring. It does, you know, it's not creating any passion on anything. It's at the end, it's about people, it's about patients, it's about babies, it's about young mothers. You know, this is what it is. And partnership is, it's all about saying, how can we join forces in order to really cover everything which is needed end to end, from acknowledging there is a problem and there are solutions existing, and acknowledging that one company alone can't make it. I am cautiously optimistic on HIV, because it means as soon as you acknowledge that there are treatment options, awareness on treatment option can lead to reducing the attention, and then you may see a sort of roller coaster of infection going on in all type of society. But if we want to make sure that we, and I keep using the word, I want to believe that one day we're going to eradicate HIV. Okay? Will it take time? Yes, it will. Does it require perseverance, tenacity? Yes, it does. But that's exactly why we are here. And how do you fuel your energy on perseverance and tenacity? You know, when I talk to you, you fuel my energy. Hopefully, when you talk to me, I can hopefully fuel your energy on the one of your team. And that's really the good thing of partnering. We are not alone to carry what is still a heavy backpack. We do that all together, and we make faster progress, and we can cover at large all the situation that we're going to encounter. It can be geographical, it can be mobilizing the money, it can be evolving the science, etc. Okay, so it means that's really what we need to do. And we need to partner also to convince local governments that, yes, we need to help those populations in need, like in Africa, but they also have to acknowledge that they have a responsibility and a role to play. And that's another aspect of partnering. We should not only partner among funders, money raisers, and industry partners. We also have to look at all the elements that are making the society what it is, and leveraging every opportunity that exists. There is, I would say, a motivation element of it, and an efficiency and efficacy element of partnering toward one common goal.
Thank you, Bernard. It's clear that partnerships are so incredibly important. But another part of the partnerships that's important is the fact that labs are really at the heart of having a strong health system. And this is another area where we know we can't do it alone. And as a result of that, we can see that Roche has just expanded its partnership with the CDC to strengthen lab systems in countries that have been affected the most by HIV as well as TB. Can you tell us a little bit about this work and why public-private partnerships are so important?
Yeah, it's a very important point, Jennifer. Why is lab important? We said earlier in this talk about everything starts with a diagnostic test. It means unless you know what situation you are experiencing as a patient, it means no clinician can make any decision or act upon. So it means the lab is at the center of every health care experience that a person will go through. And it's our responsibility as industry to come with lab solutions that are able to be as diverse as possible. What does it mean? It means that the system we develop have not only to be able to do a one test and provide a one result, but we have the same systems that must be able to perform multiple tests in record time and in quality in order to provide, the diversity that every healthcare system requires.
And that to me is progress, and that to me is learning. And one of the things I've heard so much when I've been on the ground on the continent is the impact that all of the progress we've made in the battle against HIV, the impact that had when COVID came to the continent, and the health systems that had been put in place, and the laboratories that were there. All of that is progress and so important, because there will be another pandemic, right? It's just a matter of time. But all of these things and the way Roche is evolving and the learnings that we've got are really going to have an impact going forward. And so I want to end on a high note. Thinking about optimism, you talked a little bit about optimism. Obviously, one incredible progress is you're here with us today, thank God. But in addition to that, when you think about partnerships, things that are worth celebrating, what do you see as an optimistic view of the future when you think about HIV and AIDS and that battle that we're continuing to fight?
As I said, it means optimism is because awareness continues to grow. Focus continue to grow, more companies focusing on the same cause, and that's encouraging, okay? And as I said, it means you have, one situation brings progress to a point that you can tackle even more than one single disease area. It's reported, for example, that women who do not have HIV have 6 times less risk to develop cervical cancer. Cervical cancer is one other area that for CDC, for WHO, is the new cause that they want to make sure, because we can eradicate cervical cancer. Today, not a single woman, no matter where, should die from cervical cancer. So you think that you work and focus and contribute to fighting HIV, but by doing that, you have a replica on other type of diseases because it's all linked to this immunological condition of human. And as you said, it's a matter of time before another pandemic. It's a matter of time before another virus developing that will kill people. So if you keep viruses away of populations, it's not only one HIV disease that you're going to eradicate, is you're going to amplify the effect on many other diseases and progressions. Okay, so it means I am so optimistic because every single patient that is being accessed and who is tested and who has an option to know his or her status is a win for the future. And, it means I do not see any negative. Usually, life is such that you can be optimistic about certain things, but it comes at a price. I do not see any price to do what we do today, fighting against HIV. It's only a reward and something positive for the society and for people, because at the end, we are only talking about people.
Absolutely. And it's an important step, but it is an extraordinary step that we have in the testing that Roche provides and the diagnostics and all of the labs and everything else that we're working on together. I'm going to close us out here, Bernard. You've been so generous with your time. I just want to recap and talk about, thank you so much for sharing everything about that extraordinary progress that's been made in this battle. And also talking about how clear it is that partnerships are so critical to this battle, but also at the end of the day, like you're talking about saving lives. So, Red is obviously doing our part by partnering with the world's biggest companies with a focus on testing, treatment, prevention, care, all of it. But, we can't do it without our partners. And I want to thank you again for everybody at Roche for all of the work you're doing, but especially for sponsoring today's episode. And a big thank you to you, Bernard, for sharing your story with us and sharing the story of everything that's happening at Roche. And I just want to say, stay tuned to this channel for the next episode of Red Talks. And don't forget to follow Red on social media and join the fight. Thank you, and have a great day.